pamene za bwana aenda ku clinic kuja banesa bamsa question nanga status yako ibwanji then amboka mnata then wakama tibati kupima pima paja pesa ni positive. So then amboka vakuja vafunika kuja ngati positive nivi then ambokonga vakuja vya nakamba banesi ambokonga vakuja vya.
The development aid from people to people has successfully implemented the Zambia Family Project ZAMFAM in the central and southern provinces of Zambia, which has operated for 5 years with financial support from USAID. The ZAMFAM project has improved health and livelihood of over 125,000 children and adolescents living with or affected by HIV, and has built resilience in their families.
The major impact of the Zambia Family Initiative in southern and central provinces has been the improved health and living conditions for over 150,000 orphans and vulnerable children over the 5 years life of the project, as well as building capacity and increased resilience of over 80,000 families. The project has been focusing on supporting children infected with or affected by the HIV pandemic, and currently the project is supporting 11,416 children who are living with HIV/AIDS. It has been funded by PEPFAR and USAID with the general support of the American people, and implemented by Development Aid from People to People, DAPP, in cooperation with a number of CBOs and faith-based organizations and a number of line ministries, including the Ministry of Community Development, Social Services, Ministry of Education, Ministry of Health, Ministry of Agriculture, and the local councils.
The ZAMFAM project staff have worked hand in hand with Community Welfare Assistance Committees, CWACs, and with the Community Development Assistants. It has created an effective network of systems which enabled participatory and active individual case management in the project areas, and effective linkages to health care services and other intervention systems provided to the vulnerable children.
This project has effectively implemented activities in 14 districts, covering southern and central provinces. In Central Province, we have worked in 60 districts, while in Southern Province, we have done our activities in 8 districts. And we have done our activities through the deployment and working through over 78 project leaders and over 230 community mobilizers, and also over 6,000 CCVs. The project has supported children and their families, emphasizing the working together through the action group, and this has effectively improved the welfare and livelihood of not only the children but also their families, and shall I simply say the community as a whole.
All children under the project and their caregivers know their HIV status, which is a commendable effort. Further, that all the children living with HIV are on ART, and that most of the children have their viral load suppressed.
For us to be physical, trainer to building my muscles, and for that in the fit.
Wananitandiza wa DAPP stenzo kwanza enda ku school sipenzo tilipirira baba wambo tilipirira watipasako mbuzi na nkuku na chana garden tambo kwanza kudya
kononi batu panduruida kututondeya mbulimbo ibede ZAMFAM ambo iberega a community imasimpeni ntwakachimwa twakachitambula pere bamwe bakachiri kudonaiga ino masimpeni twatarika gwenda murwiyo ni batarika kutwiha bakatwiha hinji gapati mbokulangani igwa ibana bamujala mbokulangani igwa ibana bapengede alimu akututondeya muzezo wa ZAMFAM.
There's also been an increase of caregivers in these households, accessing other equally important services such as child immunization against diseases and adherence to preventive messages against malaria and diarrhea.
Chabuno chena unapo kamba kuti bali balachitenga monga ni ma parents balatipeza mwana saphunziza batate bake zina problem but wanakwanisa utenga mwana kumufaka paja utayamba uphunzira grade 8 kuna mlonga so ni vambili vachita ZAMFAM muine mweni onera chabe mu improvement yanga baita vambili maningi batipundisa ma business mukazi ali wonse safuni konkala afunika uchitako something then bana kajedwe kabana kupunzisa na mama tipunzisa vambili kajedwe ka mwana afunika kudya vija vintu vilina pamene vina improvement mu mubili mwake.
Furthermore, economic strengthening of vulnerable households, which is one of the cornerstones for farming community, has been addressed, leading to household food security and improved ability to meet their daily needs, to take good care of their children.
Pamene nikalibe kuti tipunzire mZAMFAM sinenze ukwanirisa nenze kuti nikaesa apa nikaesa awe mwandi nenze kungowaya sinali kukwanisira kuti olo bana banga beve nikwanirise kuti ku skulu kuchita bwanji na kukangiwa sinali kukwanisa manje pamene tina joina umu tisevinga awe mwandi titandiza na tikongolesana ndrama timakukwanisa ukongola winangu akongola olo 3 pini 4 pini 5 atenga muntu tikasebenzesa futi ndrama ija futi wambobweza na binango wanzatu futi bakongola ndiye mubwino mwamene namba ukwanisira kuti ni na bana bamasiye wonse amene isunga kuti naine nikwanirise manje kutandizira kuma skuru ola kadwala mwamene omunichosamo tiye ku kliniki batapeza tandizo ndiye mubwino mwamene napeza. We say thank you to ZAMFAM for the work you have done. Thank you ZAMFAM. ZAMFAM, we thank you. We say thank you to ZAMFAM for the work you have done. Thank you ZAMFAM. ZAMFAM, we thank you. We say thank you to ZAMFAM for the work you have done. Thank you ZAMFAM. ZAMFAM, we thank you. We say thank you to
I'm one of the beneficiaries of DAPP and Zambia Family, which is sponsored by USAID. Yes, and we've also provided with this youth crop program manual, which is also under DAPP, and it has helped us as teenagers, as pupils, by sensitizing each other on maybe about HIV and AIDS, how we should take care of ourselves, and how we can prevent early marriages in our communities.
As the ZAMFAM project comes to an end, the Permanent Secretary appreciates the successes scored in improving the care and resilience of orphans and vulnerable children in the central and southern provinces of Zambia.
The Ministry of Community Development and Social Services has partnered with unsupported development aid from people to people, which I'll simply refer to as DAPP, in implementing the Zambia Family Project. And this has operated for a period of 5 years with financial support from USAID. Allow me to highlight the commendable efforts that has come out of this project. First and foremost, we do recognize the commendable efforts from our partners in complementing government efforts by reaching out to vast communities with interventions in the most critical areas of human development, especially with programs aimed at improving the welfare of the children in Zambia. The ZAMFAM project has improved health and livelihood of over 125,000 children and adolescents living with or affected by HIV, and has built resilience in these families. The other issue we want to raise is that the ZAMFAM project staff has also worked hand in hand with the Ministry of Community Development and Social Services through the Community Welfare Assistant Committees, which I'll simply call the CWACs, and Community Development Assistance. This is at district level. And I want to indicate that this has created an effective network of systems which has enabled participatory and active individual case management in the project areas and effective linkages to healthcare services and other intervention systems provided to the vulnerable children and their families.
I will now present you to some of the key results in the ZAMFAM project. ZAMFAM supported over 150,000 children in the life of the project. In 2020, 128,000 children were enrolled. The project worked with and built capacity in 3,031 community action groups. It worked with and built the capacity in over 1,000 community health workers. It improved the resilience for over 85,000 households. I will tell you some of the results from the final evaluation that was done by PRIM Consultancy in December 2020 and compared with the baseline. The families who had improved resilience and were able to pay for unexpected household expenses increased from 51% to 64%. The number of families who own livestock or chicken increased from 48% to 86%. The project had also improved food security. The number of households that was considered food secure by the end of the project was 48% compared to 26% when the project started. So indicators which show the improved education for the children include that 83% of the children regularly attended school in 2020 compared to 37% when the project started. The number of school-aged children enrolled in school increased from 78% when the project started to 89% by end line. Coming to health, the project supported in 2020 alone 11,413 children living with HIV who were all on ART. 91% of these children were virally suppressed. The project implemented many hygiene, water and sanitation activities which managed to reduce the number of children with diarrhea the past 2 weeks from 33% to 11%. The percent of children who was too sick to do home activities reduced from 37% to 13%. Finally, malnutrition in under 5 children reduced from 4% when the project started to 0% by the end of the project.
We gave them a target of 130,000 children to be reached every year, and they began implementing from 2015. They are closing down this year, 2020. So I'm very happy that they've been able to achieve both targets. In terms of their implementation, they had to make sure that the children were provided with services that meet standards of quality, that they had a case management system for these children, which identified the problem, recommended the remedy, and implemented it, and that whatever they did met standards of quality in terms of service delivery and reporting. And my role was to make sure that those results were achieved. And I worked closely with them over the last 5 years. I'm happy that they were a very responsive project. Any issues that were identified, they were able to correct them. PEPFAR guidance changes often on a yearly basis, and the DAPP was able to adjust as requested. Sometimes we ask them to change their operating districts to follow where data showed us that the HIV epidemic was, and they were able to do that without any problem. So I'm happy with how the project has been implemented. They are now coming towards close down, and together with them we'll make sure the project is closed down properly. There were 4 elements they were looking at. One is to make sure the children were healthy, meaning they identified HIV positive children through HIV testing, linked them to treatment, ART, and make sure they remained on treatment so that they remain alive. And also checked their nutrition so that their nutritional status was addressed. That's the healthy part. Then there's the stable objective. Stable means the home environment should be supportive. The economic capacity of the guardian to look after them should be improved or strengthened. So in that respect, they were providing like agricultural inputs, livestock to the families, savings groups for the families, so that the economic ability of the family to look after these vulnerable children is strengthened. That's under stable. There's also safe. So if the children are vulnerable to abuse, especially those at a certain age, the adolescents, they can easily, and if they are from poor families, they can easily be abused to have sex in exchange for money. So they made sure that the guardians were trained in parenting skills. Yeah, so that was one of the things that was done. And also the children themselves were provided with the life skills to be able to protect themselves. The 4th one was schooled. Data shows that if the child remains in school, she has less time to do other things. So being in school correlated with being less vulnerable to HIV infection. So some children were identified, their parents couldn't pay for them to be in school. DAPP, ZAMFAM took them to the schools. They had something called the school block grant, where they negotiate with the school and say, we have these 10 or 15 children who need to come to school, but they can't pay the requirements for the school. If we buy you a blackboard, or we repair your borehole, or we buy you textbooks, can you exempt them from those requirements so that they can learn? So that was an exchange now between the school and the project. So that was under the schooled objective. So those are the 4 strategic things that ZAMFAM South Central was doing.
On behalf of DAPP in Zambia, we want to say thank you to the families, the volunteers, the project staff, the community leaders at all levels, the district and provincial leadership, stakeholders, and other partners that committed their time and effort in fighting for the rights of the children for a better health and prosperous life. DAPP ZAMFAM project sustainability is through the engagement of the community and linking them to the government structures. Thank you to our funding partner, USAID.
We say thank you to ZAMFAM for the work you have done. Thank you, ZAMFAM. We say thank you to ZAMFAM for the work